An inside look at a Tennessee hospital system facing its worst days since the pandemic began. Cases increasing by 30% just last week. ICUs inundated with unvaccinated patients and hospital staff overwork. All of this happening as vaccination efforts in the area stall. Dasha Burns has the latest from the front lines tonight.
Tonight, desperation in the halls of maxed out ICUs in Appalachia.
Can you put into words how you feel coming into work every day?
We're exhausted. We are mentally exhausted, emotionally exhausted, beyond physically exhausted.
Amber Wagner is a mom of two and a nurse manager at Ballad Health, the hospital system serving the rural communities of the Appalachian Highlands. They say they've hit a COVID peak they never thought possible.
Did you think that it could get this bad?
No. Unfortunately, a lot of people have chosen to not take the vaccine, and our numbers are higher. Our patients are sicker. Our patients are younger. They're mothers who may or may not see their children again. They're fathers. And it is so hard knowing that when you put these patients on a ventilator, there's a good chance they're not going to come off.
The spike in hospitalizations at Ballad Health startling, skyrocketing in just over 2.5 months from 20 patients over the July 4th weekend to 396 this past week, an almost 2,000% jump.
For the last 3 weeks, ICUs have been full in this entire region. And when a room does open up, it's likely because a patient passed away. That's what happened right here just overnight. And the nurses tell me this room will be full by the end of the day.
This is one of our ICU.
Now there are more patients than the winter peak when NBC News was with the hospital staff. They thought they were seeing the worst of it then.
Every day we have patients pass.
Misinformation about the reality of COVID landing patients in the ICU and frustrating healthcare staff.
Just this week we have an ICU patient. He was in complete disbelief that he had COVID or that he was as sick as he was.
But with the spring came hope as the vaccine became available.
We see light at the end of the tunnel, so we're hopeful.
That hope turning to helplessness as residents continue to resist getting vaccinated.
Just knock the wind out of you all over again.
98% of Ballad Health's ICU patients did not get the shot.
I've had many patients say, when I get out of here, I'm going to go get vaccinated. But from my experience, they've not been given that chance because they haven't been able to walk out of the hospital.
Between the increase in patients and a shortage of staff, nurses are battling burnout.
It is so hard. The sacrifices that you make for your family when you leave home. And your kids are crying because they don't want you to leave because you haven't seen them in days. That's when it's hard.
These healthcare professionals both physically and emotionally drained. We saw it right there. Dasha Burns joins us now from Johnson City, Tennessee. Dasha, you've been reporting on nurses at this hospital system for almost a year now. How have things changed for them personally since you first met?
Yeah, Tom, you know, I first met many of these nurses over the Thanksgiving holiday last year. I've visited a lot since then, and I have seen these heroes find strength in some of the darkest of times. But, Tom, I have to tell you, this time it did feel different. The fact that this virus is now preventable is adding a whole new level of heartbreak here. And remember, this is a small rural community, so a lot of these nurses, they're caring for people they know, their neighbors, their high school football coach, their kid's teacher. Combine that with a staffing shortage where now you've got nurses who typically care for 2 patients in one shift, caring for 3, 4, 5 patients in a shift. And I'm meeting nurses who are working 12-hour shifts 6 days a week, Tom. And when you're in the room with them, it's palpable, not just the physical exhaustion, but their spirits are all but broken at this point, Tom.
Dasha Burns with us tonight with a very important story. Dasha, we thank you for that. We want to turn now to the Americas. We have shown